My name is Julian Wotherspoon, and I'm in the Health Studies program. First, I want to acknowledge that I am making this video today from Treaty 4 territory, which covers the territories of the Cree, Saulteaux, Dakota, Lakota, Nakota, and the homeland of the Métis-Michif Nation. I'm also grateful to those who supported my fieldwork experience from Treaty 6 territory. My fieldwork took place at the Prince Albert Métis Women's Association, which is a health and human service organization whose mandate is to design, develop, and implement initiatives that increase access to supports, reduce barriers to opportunity, and strengthen cultural resilience, resulting in improved health, safety, economic, and cultural well-being of women, girls, and 2S LGBTQ+ individuals, their families, and their communities. When I explained the special project component of my fieldwork placement, I was given a bit of a menu of things that the organization would like to see but didn't necessarily have time or resources to develop. And the one that I chose was this: to research and develop a toolkit for supporting engagement of community and partners in projects and services. Now, I chose this one because of my experience as a community organizer, which has given me a particular interest in how communities and grassroots knowledge can be generated and mobilized across different domains in order to facilitate social change. I started with a literature review, which was helpful and yielded a lot of really good information, but early in the process I felt a bit overwhelmed by the academic literature, which was all very high level and very theoretical. And it was hard for me to imagine what this toolkit would actually look like as a finished project. I was also given the opportunity to facilitate board meetings to update the vision, mission, mandate, and values of the PA Métis Women's Association over the course of several meetings. It helped me to better understand PAMWA's motivations for engaging community outside of that partnership model, and really what they were trying to get out of a toolkit such as the one I was developing. The result is this document. The toolkit is based on a communities of practice model and focuses on identifying community resources, strengths, and knowledge holders, and also underlying or root causes of community needs. And it outlines actions to build relationships and plan knowledge-generating activities within the community. While I was designing this toolkit, I really wanted the knowledge and experience gathered from these activities to not only help PAMWA strengthen the programs that they have, but also to allow them to strengthen other community resources and mobilize community knowledge to advocate on behalf of the people that they serve, with funders, with policymakers. And ultimately, I'm really happy with how it turned out. I think the skills that I got to develop and apply in order to put that all together will be ones that I take with me and apply in the work that I do in community health and in the nonprofit sector going forward.